We shall fight and conquer AIDS. We shall fight and conquer AIDS. In the name of great Africa, we shall fight and conquer AIDS.
The government and the donors buy actually 144 million condoms against 1.7 female condoms. So already we are saying the HIV is a female phenomenon, and yet we are not arming our women to go and fight this. So that is one area that we really need to top up, so that the number of female condoms that we have are at par with the male condoms. And we've been told that the female condoms are expensive, but I'm sure there are ways of making them affordable if we have to reduce the deaths that we are encountering. We want you to really help us is the strengthening of country ownership. Because as we have heard, although the donors have a little money, we don't know how long it's going to last. And we need now to bring our governments to the forefront to ensure that whatever programs we start are not 100% or over 50% reliant on donor funding. We must own this problem, and we must be able to ensure that we deal with it hands-on, as if it's our own baby. That's the only way we can achieve. In fact, I always get very worried, and I keep on saying, supposing the Global Fund and the World Bank tomorrow decided they are not going to fund us, what would we even do with the 540,000 persons who are living with HIV and AIDS and on ARTs? We would be devastated. And you can see already we have a similar number, which actually is not on ARVs. The other issue that we really need you to help us champion is to ensure that anybody who is sexually active at least gets tested. Because as we are talking, we only have 6 million Kenyans who have been tested against a population of 40 million. So imagine how many people are walking without knowing what their status are. So that is something we need to do the testing, and we need to put those people on ARTs. As you have heard, it's been proved scientifically that people who are on ARTs, the reduction on infection is 96%. So it means if we put these people on ARTs, we can actually have an HIV Free Generation. If we don't do these things, then we just be talking. We shall be talking and talking, and I can assure you, Your Excellencies, that even 2030, we shall still be talking of people dying of HIV and AIDS.
This is a woman who wants to get a baby. What is it that we can do? Because at the same time, you cannot use a condom and still get a baby. And here we are. We know that in condom use, we should be able to bring down this pregnancy. Personally, I do think, and we've been discussing this, the answer would be in the universal treatment, in terms of making sure that people have been tested and put on ARVs, and also the use of microbicides. Otherwise, we will have a problem with these people who want to get babies, and yet the only way out would be to use condoms.
My concern really is that leadership is not loud enough, organizing enough to highlight the seriousness of this disease, especially its impact on lives, but also on economic development. You know, it's almost like we are doing this as business as usual, but it is not business as usual. Another 8 hours, another 8 people will have died since we sat down here. Another 8 plus 8, 16. 170 a day, I think you said, didn't you? Now, if you had an accident every day like that, there would be a real uproar. But because they are silent deaths, we politicians are not prepared to make this an issue, and particularly if they don't win in votes. I can understand that. But I still would make a major plea that we take this alongside our all other political reforms and health reforms, to highlight the impact of this seriousness on us.
Like the mother-to-child transmission in Botswana is almost 99%. It's very high. Nearly all mothers are getting tested. So we know that it is possible, even in Africa. So how can we get to that point? That's the challenge that we pray about, and we need to really crack. Some of these things are easier done than others. And how can we do it? Thank you.